My name is Christine Pasolay. I'm 37 years old from Aptos, California. I felt a lump about 3 years ago. I was just putting lotion on my chest and I felt something very hard, and I thought, that's awfully hard for that area. It just felt like a little marble underneath my skin. At first I didn't think anything of it. I wasn't one of those people who immediately thought, oh my gosh, it's breast cancer. I just thought, what is that? Kind of forgot about it. COVID happened. I forgot about it more because of all of that. But that was January 2020 when I felt the lump. Then all the COVID happened, and then every once in a while, every month or so, is that thing still there? And by the time it was June, I felt it one day and I was like, that is still there. What is that? My mom said, you should get that checked out. So I went and got an appointment with a regular Western medicine doctor. She examined me and said, oh, I don't think that's anything, but you can have a mammogram just in case. The radiologist came to me and said, we're 99% sure that's cancer. I went back the next day, had a biopsy, and about 5 days later got the results that it was breast cancer. I was very surprised. I do have several family members who have had breast cancer, but I don't know, I just never thought about it. I never thought I would get it, and I wasn't living in fear of having it. During the 5 days or so that I was waiting to get the results of the biopsy, I was kind of not afraid of having breast cancer, but more afraid of what do I do. When I got diagnosed, I really wasn't that afraid because I knew that there were other options. Already I knew that there were choices beyond standard chemo, surgery, and radiation. I had read ChrisBeatCancer.com, a lot of those patient testimonials. That's a gentleman who had colon cancer and refused chemo and got well using natural nutrition, holistic methods. And so just having that resource and having watched the documentary series, The Truth About Cancer, those two resources really gave me a lot of info right at the beginning to know that there were other options. So when the hospital called and confirmed that it was cancer, it was stage 2 invasive ductal carcinoma in the left breast and in 2 lymph nodes. That's what I had. They read me the standard protocol. They were recommending chemo before surgery to shrink the tumor. It was a 2.5 centimeter tumor in the left breast and cancer in 2 lymph nodes. So chemo, mastectomy, more chemo, radiation, and tamoxifen for 10 years. I was 35 at the time. That's just so harsh, so much. Being on tamoxifen would take away the option of having children. They recommend you do not get pregnant when you're on that drug. Mastectomy is obviously a big operation. Concerns about lymphedema. After I got off the phone call with the nurse navigator who outlined to me the hospital's recommendations for what I do, there was just no hope. I just felt like, okay, every bit of that conversation was bad news. Nothing encouraging, nothing like, here's a ray of hope for you. There's just nothing. Do I have to do this? Is there another option? I asked God to guide me to something. And within just a few days of researching, I came across an alternative cancer clinic in Minnesota who, they really don't do treatment, but it's almost more of an advisory consulting type of clinic. And I got some input from them. So after I had been getting my monthly tumor marker tests, I realized that there was another lump. For the first year or so, I kind of was playing around trying to see what can I do to shrink the tumor without doing surgery or chemo right now. I was diagnosed in July 2020. In May 2021, I was looking for a doctor who offered vitamin C IVs. And so just locally, I found a doctor who did. I just walked into his office and asked if he offered that service. I became a patient, And when he consulted with me and found out that I had cancer, he took me on and what has been a really wonderful resource. He's an Ayurvedic doctor, and unbeknownst to me, had already a fair amount, quite a bit of experience with cancer already. He had trained with a German oncologist, and he was not an oncologist, but he had lots of excellent advice and therapies that were not chemo or surgery. So he did point me towards surgery from the beginning. He's also an MD with his own private practice, and so he encouraged me towards surgery and low-dose chemo. I was nervous and hesitant, so I chose to try other things, and he agreed to oversee me as I wanted to try some other things. Long story short, I had the first tumor. A second tumor grew after I realized that was happening. That's when I went to my Ayurvedic doctor. I decided to do black salve, which is a topical, and that got rid of the satellite tumor, the smaller second one. That got rid of it in like 2 weeks or so. I chose to keep on applying the black salve to see if I could help, if it would reach the primary tumor. The primary tumor was down deeper. At my last ultrasound at the end of 2021, they said the tumor was almost at my chest wall, tracking backwards, but it hadn't reached my chest wall, which was really good. I did not want it to touch the muscle. It was still just in the fat. So I started using the black salve just a few weeks later in January 2022. That got rid of the satellite tumor, like I said, in a couple weeks. And then for 10 months, I applied black salve for the primary tumor to try to bring it up towards the surface and away from my chest wall. Really painful, but I chose to do that because I didn't want a mastectomy. And they were telling me that that was surgically what needed to happen. Looking back, I kind of wish I had known about this place, the Institute, before I did that, because I might have been able to perhaps shrink the tumor without disfiguring the breast, because there was a big scar and some of the fat was lost during that 10-month process. So, there's a divot and it's not symmetrical. So if, I'll have to have a little bit of reconstructive surgery just to make them symmetrical again. But it did the job. It got rid of half of the cancerous tumor. It was successful, painful, kind of crude, but it did the job. So my doctor was saying the breast tumor, seems like it's under control, but right now our concern is the lymph nodes. We don't want it spreading to the rest of your body. My doctor returned from Thanksgiving holiday and said, I met someone at Thanksgiving dinner who went to the Immunotherapy Institute in Mexico and had great results. What do you think? You should check out that website. So I had the referral to this clinic from my doctor, which I think is pretty awesome for, a US doctor to recommend a place in Mexico to me, especially a place that's not traditional. I contacted Gabriela through the online form. 2 days later, Dr. Perez called me. We had a consult. After getting off the phone with him, I just thought, why not? There was no red flags, 0 red flags. All my concerns and questions he answered in the consult, and I just felt really confident that this was my next step. I was just willing to go anywhere where it seemed like the doctors and oncologists were willing to take a less drastic approach. That's why I came here, to see if we could save my lymph nodes and or get a treatment that will make the breast tumor even smaller. I think the Institute has it set up really great in the fact that they send someone to pick you up at the airport. You have transportation from the hotel to the clinic every day. Your meals are provided for you if you choose the catering service, so that if you're not confident walking around the city, you've got your transport and your meals all taken care of. And that was a big relief to me, because I was nervous about getting a rental car for 3 weeks. How do I navigate in another country? I don't speak Spanish. Gabriella and the whole logistical operations, I think, was set up really well. I felt much more at ease when I found out that they were going to take care of all that. Based on the source that I had the referral from, my doctor at home, I trust his judgment, and I was open to his referrals. And Dr. Perez was so detailed and confident in everything that he explained to me, and I can't repeat everything he said, but his knowledge base was just so thorough and so ready. He was so fast. He had answers for everything that I felt like I was going to someone who was very capable. I have found Dr. Perez to be someone who helped me feel confident in coming. Just having that initial consult with him, I hardly asked any questions. He had so much to inform me of and so much to say. It made me feel at ease that it was like he already anticipated most of what I would have asked. He had answers, he had explanations. Just speaking with him, that particular doctor, made me feel very confident that I was going to someone who had a very knowledgeable, capable person. And so I trusted him. The staff is great. They're all so friendly and kind. I love that it's smaller in the sense that the doctor is near you and that they are just really accessible for any questions you have. Dr. Alfonso is sitting right there in the room with the patients while we're having our IVs. The nurses are coming to us, and everyone's just walking around, within a few rooms, and it's all very, it's just more personal than it is when you go to the doctor. You have 15 minutes with the doctor at home, and that's it, and you've got to cram all your questions into a short appointment. While I've been here physically, I have felt fine. I haven't had any drastic reactions. Other patients have, so for me, I'm handling things so far quite well. Other patients, will say a certain IV made them vomit, and for me it didn't. I had the same one and I had no reaction. I got the IV and then went and walked around Tijuana with some of the other patients for the rest of the day, 6-8 hours outside, and I felt fine, slept fine. So yeah, only one treatment so far made me feel a little bit under the weather, but that was intentional. They intentionally dropped my glucose, and then I ate some fruit, they brought it back up, and I felt fine again. So that was on purpose. And I try not to focus on it. I try to kind of envision myself as just, I'm still me, and I'm just gonna get through this and be responsible for sure to do everything I can to manage it. I think that having a positive mindset is important. And for me, it might be easy because I haven't gone downhill really fast. So I might just be a fortunate one. Having a good attitude, try to focus on the good and not the bad. For me, I believe in God, I believe in Jesus. I pray and ask him to heal me and ask him just to lead me on the path of healing what's right for my body. And just keeping an attitude of trusting God that, if it's his will to heal me, he'll heal me. If it's my time to go, then it's my time to go. You want peace before and after.